So whilst we say that sex is binary, we as pediatric surgeons know that there are a category of children that are born with what you cannot quite determine which gender it obviously belongs to. And oftentimes you have a combination of the issues which are dictated by the genes, which we call the genotype. The phenotype is the outward appearance. And then a third factor, which is how the hormones that are produced, the androgens and the estrogens, are acted on by cells. So there are some cells which should be responsive to androgens, which are not responsive, and so will behave with the estrogen component. And there are cells which should respond to estrogens but don't, and therefore they would show up the androgen component. So you can find abnormalities. And some of these diagrams are just showing you the kind of abnormalities that you can see. Outwardly, it's either a large clitoris or an abnormal phallus. You can have elements of reproductive system of the female, the male. Invariably, they would not have descended testicles. Sometimes the testicles, the gonads are descended, but you find when you examine them that half of them would have ovarian tissue and half would have the testicular tissue. So there's a whole combination that can occur in these abnormalities, and that is what people term intersex. But we prefer to use the terminology disorders of sexual development, because it offers a very wide scope for treatment options. And the bill takes care of that, so we'll talk about that a bit later. Then I just want to refer to gender identity and transsexuals. There's nothing like 56 genders, because those are based on feelings, lifestyle feelings. So that would allow any kind of combination. And that's what we are seeing with the plus that is added to the name. Science provides and defines the limits. There must be limits to everything that comes in science. Male and female, he made them. And that is what we see. Gender dysphoria is another term that is used to categorize children who start off with their biologically determined sex and then go through the phase when they feel they are the opposite sex. Yes, and this usually occurs around puberty. But children at that age have a lot of things that they do. They go to sleep with a cuddly toy, they suck their fingers. These are all phases that the children go through. And there's a lot of experience from people from developed countries who tell us, having worked many decades in this environment,
you have to speed up. You have to speed up.
That this practice of giving them puberty blockers to block the normal changes that would happen for their genetically determined sex has caused a lot of confusion for them. I have a 4-year-old grandson. He sees me wearing lipstick and he comes, "Grandma, I want to wear some of your lipstick." I'll give it to him. In that setting, they would say, "Oh, he's thinking about being female. Therefore, let's encourage him to become female." And that would then affirm and confuse them even further.